Hello, I'm Dr. Cotter, and I'm here to talk about solutions for headaches, migraines being one of the more serious ones. But this includes things like cervicogenic headaches, it includes tension headaches, and a number of other just general headaches that people suffer from. It is a big cause of misswork, and if you've had any headaches, you understand how it can impact your life. So what I want to do is make sure you have some tools to help yourself relieve some of the pain and decrease the time that you have a headache. Number two, make sure you have a solution so they don't continue to get worse. So let's first talk about where headaches typically come from. There's hundreds of causes of headaches, but a lot of these are triggers, and there's an existing problem that's underneath your skin that's pre-existing. One of the more common things that we find is a loss of the cervical curve. So your neck should have around a 40-ish degree curve in it. When we see a loss in the cervical curve, it looks like this. Other words that have been given to this are things like text neck and forward head posture. Really leads to a lot of general problems, but headaches being one of those. The muscles that attach to the bones come up and attach to the skull. And when you lose cervical curves or a general misalignment, those muscles start to pull on where they're attached to the bones all the time. They pull abnormally. There's low levels of inflammation, even when you don't feel it. And over time, that stress in the muscle and where it's attached add up. The nerves start to get affected. They start to become hypersensitive over time. And then it just leads to somebody being dehydrated or not getting enough sleep, or having your head in a bad position for too long, like looking at your phone or other things that then trigger the headache to happen. So that's kind of where things come from. That's our starting point. So if you feel a headache coming on, or some of these techniques we're going to show you are going to help give you the ability to prevent headaches from forming as often with that. So we're going to go through a few of these muscle stretches and some of the typical muscles that contribute to this. We're now going to show you how to stretch some of the muscles that are most commonly involved with headaches and migraines. Now the first one we're going to do is called the splenius muscle. It attaches to your skull and comes down and attaches to your spine, runs along this part of your neck. When you've lost that cervical curve, it tends to be stretched, one of those muscles that's always under tension. And when it's had too much, it'll let you know because it'll trigger a headache with that. So the way we stretch this is you're gonna put your elbows on your knees, and with your back not very rounded, you're gonna keep it fairly straight. You're gonna tuck your chin to your chest and bring it down. Now you're gonna put your fingers on the back of your head, and you're gonna add a slightly more stretch. Not very hard, just till you feel tension along this area through here. And you're going to hold that for about 15 to 20 seconds. Now, if you want to get more one side than the other, you can turn your head towards one direction and then bring it down again. If you turn your head to the left, you're going to feel it more on the right. If you turn your head to the left and do this, bringing it down, you're going to feel it more on the left. So this is a way you can target either side if one becomes more of an issue, or if you feel it giving you more relief from hitting one side more than the other. This is a way to do that. Simple but effective. Do this 2 to 3 times. If you have a headache and it's ongoing, migraine, any of these, then you may do this several times over a day. And it will help relieve the pressure, keep the pain down, and help you get over it quicker. So the next muscle that we are going to go over is called the temporalis, and it's right through here. And it also is a major player in a lot of the different migraines and other headaches. So with this one, you're going to have your fingers facing forward, fingers or knuckles, and you're going to drag with a little bit of pressure straight backwards, slightly opening your fingers as you drag backwards. And it's a way to get some pressure and to kind of do a self-massage. You see, if you put some direct pressure on a muscle that is tightening up and protecting, you can get that muscle to calm down for a little while. And that's basically what we're trying to do with this. You can go at some different angles because that muscle fans out as it comes up. And so by going down and backwards, up and backwards, you can hit more of the fibers going directly across them. Do this 10 to 15 times. And again, you can do this one several times if you find this is giving you some good relief from it. Now the last muscle we're going to show you is going to be kind of a combination of the trapezius and your levator muscle. And those attach right from back here and come up. And this one, if you want to turn and face kind of forward, you're going to start off by bringing your head laterally to tension with your hand up here. So you're going to bring your head laterally just until you feel that muscle tighten up. Let your other arm kind of just hang down. Now, some people will feel more tension if they bring their head straight sideways. Some people will feel more tension if they bring their head sideways and forward. So it's at about a 45 degree. We're going to start with this one, if this is where you feel the most tension. You're going to reach your arm backwards, okay, about 45 degrees backwards, and without pulling on your head anymore, you're going to reach down like you're trying to touch the ground. That's where the stretch is going to come from. Hold that for about 15 to 20 seconds and relax, and do that on both sides. One side you're going to notice is almost always tighter than the other. Now, if the place you feel tension is bringing it straight sideways, now you're going to have your arm straight to the side and not back here, just straight to the side. Again, do not crank on your head, you just bring it to tension, and that's all the more this hand does, and then your stretch is reaching down like you're trying to touch the ground. And you will feel that coming down more towards your shoulder as opposed to more down the back side. Whichever one gives you the most relief, that's the one you're gonna focus on. No problem with doing both of those, and this one can also be done multiple times during the day. If somebody has a lost cervical curve and that curve is not corrected, it'll lead to increased degeneration. Now that's going to lead to bigger problems that come from numbness, tingling coming down the arm, neck pain, more frequent headaches. All the different kinds that we mentioned will happen if that neck curve is not corrected, if the alignment is not corrected. Now, what we see happening in there is specific levels of the spine that are responsible for the lost neck curve. We see those starting to degenerate and getting smaller. I don't want to give you tools to just relieve pain, but not actually correct the underlying problem. So that has to be addressed as well. So when we see pictures of a lost neck curve, which you'll see here, x-rays of actual people, you see how the neck curve should be like this, and now it's like this. And we see some cases where it gets really bad, and we call that a reverse curve. And unfortunately, we're seeing this way too often in it, which is why headaches are really common. Now, if that curve is not corrected, it will lead to degeneration of the actual discs, which you'll see in these pictures from actual people, what it looks like on x-ray.